746. Rachel Grove is with us, Director of Social Services, IRMC. It's always good to have Rachel in the studio with us because she's so darned informative. Our visit is presented by Marcus & Mack, voted Best Law Firm and Best Personal Injury Lawyer 4 years in a row. In the Best of Indiana County contest, you can visit them online at marcusandmack.com. Good morning.
Good morning.
It's good to have you here.
Thank you.
But we want to talk about this event, Pathways to Better Health. This is a 4-hour event happening this afternoon, and in a unique location for IRMC, which we're going to develop because it really is sort of like a kickoff to that location as a future home.
Yeah,
for
a little
IRMC.
bit.
Yeah. So let's talk about Pathways to Better Health. What is it, and how can folks benefit from it?
So we will be up with our mobile unit in the parking lot at Regency Mall at our location up there. That will be soon to be opening this summer. And Pathways is an opportunity to talk with some staff about access to care. You know, if there's things that are getting in the way of you getting to the doctors, getting the things that you need, basic needs even, from medication to resources, that kind of thing, to insurance. You know, it's stop up, check us out. You can talk with some of our social workers there. We're going to be helping with applications because one of the biggest barriers to healthcare is accessibility and affordability. So when you have health insurance, it's a little easier to go versus when, you know, you're questioning yourself, am I going to get a big bill from this? Should I go or not?
Yeah, that can really stand in the way of someone actually going to get treatment or to get an
People
assessment.
have to make decisions, you know, can I afford this bill or household needs?
Yeah. So for a lot of folks, they say, my insurance isn't going to cover it. I'm not even going to try. You can help them with
Ask
that.
questions. Yep, ask questions, even when you're just at the doctor's office. So like an event like today, we can help kind of direct and navigate people through the healthcare continuum. But even when you're just at your doctor's office, tell them those things. They have resources that they can provide, like what we'll have today, to help kind of get people where they need to go.
Yeah. There are ways to, I don't want to say get around, but certainly ways to navigate through the healthcare system, overall system in the United States, where people might be surprised to learn how much help there is out there for them.
There are a lot of programs. We don't have answers for everything, unfortunately, but there are a lot of programs, even just within our community, that are financial support kinds of things, programs at our assistance office that a lot of people qualify for because income thresholds are higher than I think most people expect as well, too.
Medicare, Medicaid, those are two things that just when people hear the term, they say, I'm stepping out. I can't
don't
navigate
qualify. I don't, you know, I'm not old enough. Well, again, let's look, ask questions, and see.
Medicaid especially is one that's hard to navigate.
It is, and there's a lot. They do have a lot of programs that people can qualify for, even as individuals or households. And we're happy to kind of provide some information on that and give people some direction of where to go.
Yeah, plus IRMC has its own financial assistance programs that can step in too.
Yes, exactly. And we'll have those brochures available today too, and kind of can give some direction about how you fill out the application and what to do with it.
Now, you mentioned medications. Medications is its own special category, isn't it?
It is.
Yeah.
So affording medications is tough. There are programs out there. Sometimes it's asking your doctor more questions too and letting them know that I haven't been able to pick this up. Are there other options? But we're there to help print out some applications for people if there are prescription medication assistance programs, even just shopping around at your pharmacies too. You may find a little difference in prices as well too.
Yeah. All right, so today the event is from 2 until 6.
Correct.
And Regency Mall, it's the location, it's going to be the mobile unit, the new mobile unit.
Yep, you'll see us outside there in the parking lot.
Yeah, and just pull up. There's plenty of parking all over the place.
Yep.
And when it's free. And when you go, what should people bring? Because people have specific circumstances, I would assume, that they have specific information that they can bring that can help you to help them.
So if you have medication questions, definitely bring that information with you so we can look that kind of stuff up. Income info is one of the best ones. If you have like some pay stubs, or you can pull that kind of stuff up on your phone. But that's the biggest one is income guidelines is what we would look at for a lot of the programs.
Yeah, yeah. I know Social Security can play into this. Pensions and disability insurance. People who are self-employed might think that they don't have any options either.
Right, and they do. So we're right in the middle of tax season too. So if you've done your taxes already, just bring that first page or bring that packet that you did your taxes with too. That's helpful.
Even things that you don't really think could be related, like your car payments,
Yes.
and things of that nature, can help you again to help them figure out what are my options.
Right. We want to be a purposeful, productive person. So a lot of that revolves around going to work, and we need vehicles to go to work. We're in a rural community. Those kinds of things help you qualify too if you're paying for those things as well too.
Can they bring medical bills? Would that be helpful?
We can take a look at where they're from, especially if they're from other areas too. Like other hospitals have patient assistance programs as well too. So certainly we can take a look at those and give some potential suggestions.
Yeah. So all of this is going to be available for folks. You don't need an appointment,
Nope.
correct?
Nope.
Just show up,
Just show up.
and someone will help you. I don't think you really have to knock on a door.
Nope, we'll have some tables outside, and
Yeah.
like I said, we'll have our mobile unit. So we have 2 rooms in there that people will be set up in, and there'll be a greeter to kind of, if we get a lot of people, keep people organized.
Yeah.
and
Yeah. I hope you do.
I do too.
Because there are so many people out there that have these sorts of questions, and they say, I really don't know who to ask or how to find out all of this information that might be something that I could take advantage of that could help me with whatever my medical issue is. And here it is, it's free, and you just need to come and get the help that is readily available for free today. Yeah.
Yep.
Big doings. Okay, 2 to 6 today. Again, the Regency Mall, where the old VA clinic used to be,
Exactly.
correct? Yeah, that's where you're going. You won't be going inside the building. That's where they're actually working.
Correct.
In order to get the new facility opened up this summer. But the mobile van will be there, the mobile unit, and you'll be able to just
Yep, we'll
access.
be heading there after we leave here.
Beautiful, beautiful. All right, so that's 2 to 6 today. Everybody can come. You don't need an appointment. All of these are just wonderful folks from IRMC who are there to help you. All right, so Rachel, we want to turn the conversation in another direction. May is coming up very soon.
It is.
May is Mental Health Awareness Month.
Yes.
Folks need help, don't they? Yeah, and so we need to pay attention to that. There obviously will be all kinds of interesting information and processes coming from IRMC. But I wanted to ask you, just as someone who is, of course, from IRMC and with social services, about mountains and how mountains, we're a year into it, aren't we?
Yeah.
Pretty much.
Yes.
Coming up on a year into mountains being open, mountains behavioral health, and it really has changed the game a little bit in Indiana County.
It has. It's provided an opportunity right here, local, to even our surrounding counties to provide some resources and care for folks that are really in need.
Yeah, yeah. It used to be that before mountains opened, when someone came to the emergency room with a mental health problem, they might have been stuck in chairs there because there was no place really for them.
Yeah.
But IRMC saw that need and saw an opportunity to help people in a whole new way. And that's exciting.
It is. And they're looking at opening up some more beds as well too. So you're going to see things continue to grow, and it's a place to get care that's close to home for folks instead of bed searching, waiting.
Yeah. I think one of the most interesting aspects of it is there are 3 separate units there, and they don't mix together. So you've got the adult unit, you've got the adolescent
And
unit,
the geriatric.
and the geriatric. They meet specific needs of people within those categories. And I thought the geriatric, when I was there to tour last year, I thought the geriatric place was really, really well set up. They all are. But the geriatric, of course, they take into account the physical limitations that geriatric patients have that others may not.
Yes, yes. So you're going to see a lot of things coming up in May, too, for Mental Health Awareness Month. And again, if you've got a loved one or you're struggling yourself and you fall into those categories, reach out to your doctor. If you need to present to the emergency room, reaching out to crisis is a great place to start. And we've also got some other partnerships opening up soon on campus as well, too, all in order to get people the care they need to go for their mental health needs, no matter what age, and hopefully keep that continuum going and not creating more barriers and delays.
Yeah, I think it's just a wonderful facility for Indiana County, and it really does change the way that mental health is viewed and treated within our region, not just in Indiana County.
Right.
People
right.
come from very far away, too.
I think there's always going to be a little bit of a stigma, but we're seeing improvements, and we're seeing the bigger community kind of understand that it's touching a lot of people's lives.
Yeah, it's an exciting thing. I really, really am very hopeful for the effect that Mountains Behavioral is going to have on all of the region. It's good stuff. All right, so this afternoon, Pathways to Better Health. It's from 2 until 6.
2 to 6.
Absolutely free.
Yes.
Come, bring your concerns, bring your papers with you. And if they don't need those particular papers, they'll just tell you, just keep that in your folder there.
Yep.
And you can help them with whatever their concern might be. You've got the answers today. Or you can
hopefully most of them.
Point them in the right direction.
Yes.
If you don't have the answer readily available.
Yes.
Beautiful. Thank you, Rachel.
Thank you.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160.
At First Commonwealth Bank, we know that financial confidence begins with the right account for the way you manage your money. All of our checking accounts are packed with online tools, including Credit Score Manager with 24/7 access to your credit report. And our debit cards are eligible for MasterCard ID theft protection. Find the best checking account for you at fcbanking.com. First Commonwealth Bank. Time to be first. Member FDIC.
We at Shoemaker Family Services believe it is important to be realistic in respect to funeral expenditures. We personally do not want a family to spend more than they are able, nor less than they would like. We want to eliminate the possibility of emotional overspending when you're not thinking as clear as you normally would. What is important is that the arrangements be kept with the family's wishes as well as their budget. The most important